Hey guys, welcome back to the True Sports Physical Therapy Podcast. Today's guest that I had on is such an outstanding human, an outstanding physical therapist. His name is Dr. Tim Stone. He went to Salisbury University, graduated with a degree in exercise science in 2014. Also, well-known fact, he was national champion, lacrosse national champion in 2011, 2012. He really came up as the lacrosse sports physical therapist and now has grown working with NFL athletes all the time, really applying those concepts across many sports. He got his doctorate from the University of Maryland, Baltimore in 2017. He is the COO at True Sports and has been with us for the last 8 years. In this conversation, we dive into what it means to be a great coach, how to make an outstanding session for your athlete. He also hits on some of the nuances of ACL Rehab. And the reason we kind of bridged those gaps and brought those things together is because he has an awesome course coming up in New Jersey at Blue Iron Physio in Tenafly, New Jersey. That's January 10th and 11th. It's his in-person ACL masterclass. And you'll hear Tim talk about it in today's podcast. He is an absolute savant as it pertains to the ACL. So if you want to learn about how to take your athlete from the OR table back to the field of competition, Tim is going to walk you through that in person. Sign up now. It's worth 19 hours of CEUs. Totally worth it. Totally engaging. I encourage everyone to sign up for that course. I think there are a few spots left. Without further ado, here's my conversation with the great Timothy Michael Stone. Welcome back, guys, to the True Sports Physical Therapy Podcast. We have a common, frequent guest, Dr. Tim Stone, with us to enlighten us on the art of coaching. Now, Tim, let me blow you up a little bit. You are one of the absolute best physical therapists that I have the privilege of working for, that I have followed on social media, that I know, that I've had on this pod, at developing buy-in, nurturing positive relationships with your patients. You're just outstanding at it. And what I want to do in this 45 minutes to an hour is I want this entire audience to learn how it is you do that. Okay? So that's what we're going to cover today. Before we get into that, I want you to tell everyone what your daily is like at True Sports, because one of the things I wanted to accomplish with this podcast is to educate all the physical therapists out there on some of the amazing things that we can do with our profession. You've taken an outstanding route. Why don't you just walk us through a day in the life of Dr. Tim Stone at True Sports?
Absolutely. One, thanks for having me, and also kind words. That was very nice to hear. So basically, my role at True Sports is the chief operating officer. So I handle a lot of the operations side of the business, and then I sort of tag team with you and our regional directors in sort of just managing everything across the board as a team as well. But specifically, my role really is to handle the operations across all 15 of our locations, soon to be more, hopefully. So what that looks like for me in terms of a balance between patient care, because I still am involved in some patient care and working, on the business side of things, is I take sort of this year-long approach to my schedule. So I'm really fortunate in that I've developed some really deep, close relationships with some different universities and some different athletes and some different college athletes, a little bit of pro stuff as well. So I really dedicate my summer break and winter break that lines up with the college athletes to my bucket of treatment time. So during those times, I might treat 2 to 3 days a week. So we're talking maybe 20 to 25 sessions during those breaks. But really outside of those breaks, I'm, majority working on the business and on the operations side of it. I might do like 5 to 10 visits per week just to keep my skills sharp and, really just serve the community of people that I have a personal relationship with. So, you can't really call True Sports so much and book on my schedule. But if I have a personal relationship with you or in the community, or someone reaches out to me and wants me to, do a favor for someone, I'm always up for that too.
Yeah.
On the side, yeah, go ahead.
Now, I was going to say one thing I just want to highlight there is you said making sure you stay sharp. I worked for a number of individuals in the past that stopped treating, and I felt like they got stale very quickly. Outside of treating, you're running so much of the business. Then you're going to treat in these blocks, like you said, during vacation times for schools. How do you stay sharp enough to handle the high level athlete when they walk in?
Yeah, that really is probably my biggest challenge is switching from business hat into treatment mode. And that sort of, is me sitting in this room in an office in Woodbine and then quickly jumping down on the first came from a session, jump back up here. That is a difficult transition. What I try to do is, on a Sunday night specifically, I'll write down all my goals from like perspective for the week, in those buckets. I have all my weekly meetings already scheduled and things like that. And so I kind of know where my gaps are for patient care so that I can really focus on somebody when they're in front of me. And then I can switch back and transition back into the business side of things. And when I come to sit back at my laptop, my computer area, I kind of know exactly what that next thing is that I'm going to do. So I try to do my best at that. Obviously, things at you through the day, and that can be a little bit of a challenge if someone needs something urgently and I'm in the middle of a session. It sort of has to wait 20, 25 minutes if I'm like halfway through that session. But yeah, I really try to like portions of time throughout my day, so I kind of like know when I can, give everything to a patient or an athlete, everything, back to the business as well.
Yeah, it sounds like preparation is your calling card. Like I know every single Sunday night I'm going to get minimum 3 emails from you on the operations and business side, and it sounds like you're also like laying out your week Sunday night so that you can just almost go through the motions during the week because you have planned it out appropriately. That goes a long way both on the business side as well as on the clinical side. Um, we're going to come back to the piece that I heard you say, which is so important, which is developing relationships, because you're outstanding at developing relationships. You said like if it's someone I know or someone I have a relationship or a friend of a friend, et cetera, I'm sure that circle really gets wider. You're going to be there to uphold those relationships. And by the way, that turns into the success of true sports, because those relationships turn into referrals, they turn into future opportunities, et cetera. You're outstanding at upkeeping those. So we got to come back to how you develop relationships. I just want you to define what it means when you say operations. Well, I work in operations. What does that mean?
I don't think I really knew that much about it too when I self-appointed or self-designated my title. I think you're not a big title guy.
But they're important. Sort of like you made me realize it's important.
Yeah. So basically, in a nutshell, what I, initially tried to focus on is basically joining all of our clinics on simple structure, meaningful procedures that are consistent across the entire company. And so that would be a really broad umbrella in what I do. So if clinic A runs, like this, particular schedule, policies, workflows, SOPs, all these kinds of things, in that clinic is in Bethesda, Maryland. When I travel up to Hummelstown, Pennsylvania, I also want to know that the same processes are taking place, the same workflows, the same SOPs, the same structure, all that kind of stuff is consistent across the board. And so mainly, I think, my centralize all of those things, one hat, which is my hat, and then delegate those people who are owning those SOPs and things like that. Whether that's on more of a clinical side, on the clinic director side of things, or regional director side of things, or even at the staff PT level where we're, making sure that all of our PTs have the same clinical progression or similar clinical paths and progression so that they're providing the same product that we expect across all of the clinics. Or if it's on communicating with our head of admin and making sure we are tight on what our scheduling process is or billing processes are. That's also something that I kind of tackle as well.
Yeah, and I like that you point out the two arms to what it is we do. Like, you have gotten systems and procedures on the business side. Like, what is it like to check in? What's it like when you call True Sports? What's it like as you're scheduling out with the front desk? Like, all that business of it, the insurance verifications and administration and authorizations. That's on the business side. And then on the clinical side, I think it's like a finer line, or a more convoluted dance, because there's so much art in what we do, right? Like, every ACL is not going to look the same, but there are standards of practice that we impart to our therapists, so that a given session, it might not be exactly the same. Like, day 3 of your ACL in Woodbine versus Bethesda might be different, but they're headed towards the same goals. I think we've done a good job, hopefully, I'm sure there's always room to grow, of making that look uniform. And I think that kind of falls under like the clinical operations side. So I'm glad you kind of mentioned that. Let's dive into your relationships. And because the word relationships applies in everything that we do in sports physical therapy, certainly on the clinical side. And like I said, you have very strong relationships throughout the sporting world in Baltimore, Delaware, and Pennsylvania. Tell me about in session, maybe the difference between instructing and coaching, right? Because the name of this podcast is The Art of Coaching. So tell me what the difference is between that terminology to you.
Yeah, I mean, I think that I would fall more on the side of, I think instructing would be laying out the exercises and execution of a patient moving through those exercises. Whereas coaching, I would put more to, some of those less like objective tasks. So motivating, right? Communicating and connecting so that you're getting the best out of every one of your session from a patient that's, in front of you today in that moment, who's got a ton of different things happening outside this world that needs you to accommodate and adjust to, but also like keep on task. So I think that's really like where I would define the line between instructing and coaching.
I think that's a great delineation. What makes you a great coach?
I think, one, I always have an end goal in mind for that session. So what am I trying to achieve with that patient? I think that's like a really strong basis or foundation that you need to go into every section to be able to coach from. It sets you up for where you're going to push, where you're going to like pull back on. But also on the flip side of that, I think there's also a really high level amount of flexibility and adaptability that you need within that session in rehab, sometimes more so than with healthy people. So more on like the sports performance side of things, I think you have to be able to willing to like completely throw out an exercise and replace it with something that still meets the goals of what you're trying to get, but looks completely different to what you had planned in there. And I think that's like the nuance to be able to be like, really, really good at still moving forward or moving everything up and to the right, without being, an online programmer that's delivering packages and delivering things where it's like, do these exercises.
Yeah. So how do you do that? You have a given plan, and stuff starts to go awry. So often ACL rehab, it's that hurts my knee. That hurts the front of my knee. How do you remain nimble in a given session? Can you give me specific examples of when that's happened?
Yeah. Really simple would be like, let's say we're trying to improve someone's quadricep muscle in ACL rehab. And we're trying to do that now. Are we going to do it from an open chain perspective? Or are we going to do it from a closed chain perspective? So let's go through like a closed chain perspective, for example. So I could, in my brain, list 20 to 30 different exercises on a continuum that as closed chain, that's going to involve some sort of like triple flexion to triple extension or double flexion to double extension if you're, not moving at the ankle, and basically like rank them in, most quad proficient and least quad proficient, but also what comes with most quad proficient typically is also greatest stress on the knee. So you have like least stress on the knee, probably, and least quad efficient, and then most stress on the knee and most quad efficient. So I pick the point on that continuum where I feel like that patient fits, and then I just like move laterally either into, if it's, you know, going amazing and it's not, and it's effective, but I could get more out of it, I shift to the right, to the more quad efficient and, you know, more stressful on the knee joint. Or if it's not going so well, I'll just bounce down. So let's pick, for example, like a box tap down, right? So if I set that up as an example, right, if the force is, you know, all vertical down, the most quad efficient or the most quad challenging for someone like that would be, you know, the swing leg or the leg that's not on the box is tapping forwards, right? And then we can think about things like external load is going to add more quad stress to it, also knee stress, and then more depth or more range of motion is also going to add more quad stress or more stress on the knee as well. So like if I say like my goal for this person is, you know, we're going to do an anterior tap down from a 12-inch box with a 40 pound kettlebell. Like that's where I want to start. Now, if they say in that exercise, like, no, I'm getting pain in my knee or whatever, I have like multiple different levers that I can pull. So I can either go, okay, we're going to tap behind you because I know that's going to require a little bit more hinge work. So it's going to offload that knee a little bit, but it's also going to offload that quad. I can decrease the height of the box. So I can still have them move in the same direction. So going forward, but I just decrease the load by decreasing the depth, or I can decrease the external resistance as well. So I can just decrease that kettlebell. I can remove the kettlebell all the way, so that I can kind of still get the same goal out of the exercise, which is closed chain, triple or double flexion and double extension. So basically like challenging the quad in like a closed chain environment. If all of those things fail, then I just change the exercise into like a different movement pattern, like altogether. But that's kind of how I would regress or progress within that same scope.
So I think that's so important for both new grads and experienced PTs, is to have this massive library of exercise to pull from, understand what's harder, what's easier. And then, like you said, having the humility to say, okay, we'll come back to this tomorrow. We'll come back to this on, you know, Thursday or whatever. Let's go to a different exercise. It's also the prep. Like we talked about that with your operations and what you do on Sunday night, but like before going into a session, it's preparing. Like if you're a new grad listening to this pod, literally go through and write out, one, your goal for the session, two, what are the steps that you could possibly take to get there, and give yourself so many options, like a choose your own adventure, where you can then, it's very easy and you can do it nimbly and confidently so that the patient doesn't think, oh, geez, like he's just guessing, where it makes sense to begin to change your inputs or your strategy to get to the given goal. So I think it's great that you highlighted that. It kind of ties in both ends of what you do, clinical and operations. So much of it comes down to prep and having things laid out in front of you. So make sure you're doing that at home. I think that's great. Anything else to say on that piece?
I don't think so. I think the only thing I would add is, you know, earlier on in your career, it's more important to write down those things and develop like the principles to meet the goals that you're looking for in a session. So writing out the specific exercises in the blocks that you want to train with someone, and then having that like lateral pick, like either regressed or progressed from what you select that day, is really important. So now you have like 3 options minimum for each one of those blocks within each one of those exercises. But then as you grow in confidence, you grow in like speed, and you grow in breadth of knowledge of regression and progression, I just go back to my principles. Like I probably don't even write out what it is for each one of those blocks. I know what the blocks are that I want to perform and like how they want the structure. And I can be a bit more adaptable within the exercise based on like what happens in the first 10 reps of the first set. Like that will shift what I'm doing, you know, in the rest of the session. For example, like if I go through my warm-up progression and then my first block is going to be, I want to stress like heavy external load of resistance, your more basic movement pattern, like let's say it's like a rear foot elevated split squat, right? Something that I can like push the weight on, but maybe has a few more variables, is not like amazingly single leg quad dominant. If they're doing well in that exercise, like I want to continue to push and focus on that. So I might do an extra set of, or I might push the resistance or push them to failure in that like first set, which is going to then change how I go about it for the rest of the session. And also might change it if they're not doing so well. Like if they're not doing so well, I might completely drop, sets and reps, but then I didn't achieve what I wanted to on like the external load stress. So I'll try to pick that back up later in the session on something once maybe like their knees warmed up and we try it again and it like feels a little bit better. And so like you get better as the more people that you treat, the more patients that you see on being able to add flexibility and change sessions on the fly. I do just think it's so important. I just remember like picking this up from you specifically. Like I would just have like my notes on my Mac, like all the way written out for every single patient that comes through. And I still do that for like extremely like high level individuals where there's a little bit more like pressure on like your time management and things like that. And there's more pressure from a sense of like a time limit, or it's dollars and cents that we're like losing for time here. So I'll like, attenuate that to like higher level individuals that really need that, extra little bit of planning and prep.
Yeah. Yeah. I think that's really important. Okay. So I want to come back to some of that relationship idea and building trust within a given session. We just spent a bunch of time talking about blocks and periodization and mechanics, like really some of the heavy clinical lifting of what it is we do. How do you reconcile all of that verbiage, which to you and I and most people listening, we know like the back of our hand, to the athlete that's in front of you, where one, you want to show them, hey, I know what the hell I'm talking about. Like I am a doctor of physical therapy, so I can speak the medical game. And also I want you to understand what we're doing and I want you to trust me. So how do you deliver the information to gain trust, show them you know what the hell you're talking about, and also relate to them?
Yeah, I think you're always trying to pull on those different levers at a different like emphasis with every patient, and that comes back to basically like meeting them where they're at and what they appreciate or what you think that they might feel like is important to them to gaining trust. So maybe an athlete that you're working with would feel a lot better to know that you've done this with the same caliber of athlete that they are, excuse me. All right. So if you have an NFL level, DB, like it's helpful to draw from experiences that you've had in an exercise with another high level DB that you've worked with. And so just explaining that can be really helpful. Making connection between two athletes that you've worked with who know each other at that level can really help in terms of like trust and buy-in. And so like that might be one lever that you can pull in a session, or I might pull in a session. On like the more clinical side of things, I really try to get a feel for what type of athlete they are. So maybe they are really curious, inquisitive. They love the training and performance side of things. That's someone I can think of, an athlete that you and I both treat at that level. They want to know the nuance between the difference between their foot in front of and their foot behind, or how external loads or depth and things like that manipulate the work in their quad, because they're so bought into making this thing work from like a scientific perspective, and they want to be able to run those same principles themselves outside of the sessions. And so that's something I would communicate or talk through much more with them, just to show them I have a deeper level of knowledge in that exercise or in what we're trying to develop with them. But sometimes you also, this goes both ways for whatever level the athlete is, higher or lower. It may just be like their training age, right? Like maybe this is their first time really doing, strength and conditioning type exercises. For those people, like I might just go as far as saying like, this is an exercise to work your quads. Like that might just be enough for them. I don't really feel like I want to get them lost in the nuance of foot forward, foot back, depth, load, all those things. Just say like, we're going to work on quads right now. And that's like really sufficient for them.
So, okay. So this is super second nature to you. which is your ability to read the room. Like you have an understanding of the athlete's training age, their level of interest, curiosity, background knowledge in whatever task it is that you're trying to give them. How do you glean that? Like
I mean,
boil it down to simple steps. So how do you read the room?
yeah, I think you're picking up on different cues from them, right? So one really easy way is to ask questions from the get-go, right? So like asking them about what a week typically would look like for them, like in their training, like previous to being hurt, is a really good way to understand like what level of knowledge they have, about the weight room, or what not knowledge they have about like their movement competencies and things like that. So broadly, the answer there is, ask questions. Ask questions that lead you to the answer of, do I need to develop this relationship from a trust perspective, and that they know that I've worked with that caliber person before, or is it like I need to build trust from more of a like scientific or like clinical basis, because they've already written out their next 6 weeks of nutrition, sleep, monitoring, strength and conditioning side of things. And so you can pick up that really, really simply by just asking questions about like, what's a normal week of training look like for you?
Yeah, I think you're right. It starts with asking questions and it ends with, you have to listen. Like you have to hear that things. Like too often I'll see clinicians ask these questions like as mundane as what was your date of surgery, what was your mechanism of injury, what's your past medical history, and they're just like typing their note, right? It's really different what you're describing, which is, tell me about your week training, and you're listening, and that's the operative word there, for clues and cues. Like, does this athlete describe a Bulgarian split squat? Do they maybe use the term, we did that squat thing with my leg behind me? It starts to cue you into like how clued in they are, and maybe can guide the way you interact with them. I think it's a great idea. How do you, like, I've had athletes playing in the NFL. They come to me, and I try to be very sensitive about dropping other people's names. Like, oh, I also worked with this guy and this guy and this guy, right? Versus letting them know and instilling confidence. I work with NFL guys. How do you how do you read that situation and dance between that?
I don't work with that many NFL guys, so it doesn't come up
Let's
all
talk
that
about
much.
the
I'm
PLL.
more have to lean on the clinical side in that. But no, I think there is a fine line for that. I'm not sure if I could really like put my finger on like how to feel out the right moment to kind of doing that. I think one thing that really does come to mind on this is, and this is kind of like a bit of a necessity in the niche that we're in, but you can already set the tone for that kind of stuff based on the type of people that you want to work with by presenting that stuff like through things like this, or like social media, for example. Like, even if you're not growing a massive following or anything like that, like I'm not in the tens of thousands of followers and things like that, if that athlete wants to vet you out and they can see this, like your social handles as like a resume for whom you've worked with, the types of people that you've worked with, that's a really good way to connect without like necessarily like name dropping in a session. But I think also too, like those things come from like, if you do need to lean on that side of things, it comes from asking them questions about who they've played for, where they're from, what position they've played, like who they may have come in contact with or in cross paths with. There's some sort of connection there. So like maybe you're working with an athlete from Baltimore County, right, that is a really high level MIAA lacrosse player, and they tell you that they go to that one school. Like, they're going to know the coach that we work with a lot there. Like, making connection that way is really good. And that we've worked with a lot of athletes through those programs. That's a really good way to pick up on, how I can connect with this athlete without necessarily like just starting off with name drops. But different good way to like connect people or different experiences. And then like your social media, I think, is also just a huge pillar of a working resume essentially for you.
I love the way you put that. It's just a different lens through which to see Instagram. that they're going to see your Instagram before they walk in. They're going to know who you work with. It's a great time to highlight it versus just spouting off the names of who you worked with, not to mention all the HIPAA implications. Okay, so that's great when sessions are going awesome. Like we talked about, maybe a patient has some pain and like how do you work around that in a given session? Me personally, I struggle so mightily when a patient cries. So sometimes a patient will cry mid-session because they're frustrated, because they're in a bunch of pain. I like freeze. I don't know what to do. Sometimes they are infuriated with where they are in the process. Like this is day 56 of a rehab that's going to take 300 sessions. This is session 56 of 300. So, and they get so frustrated, and it kind of derails the session. What do you do at those critical moments? Patient loses their crap or they start crying mid-session. How do you handle that? You're way more equipped to answer this question than I am.
I'm not sure about that. The crying thing, it's really pertinent that you bring it up, that like you would like necessarily a big ticket item on like connecting with patients, but it happens more often than you think. And kind of, and a lot, sometimes also like unexpectedly from people that you think it's not going to happen with as well. And so it can be like, it can cut you off guard. I would say my number one tip for this is to basically like, listen, hear them out on what's going on, and then trying to find the time to like break away and give them a second to regather composure before you step back in. So a really good way to do that is to like step out and offer them a glass of water or something like that, where you can just go and grab it, bring it back. And usually by the time you get back, they're kind of like sort of their, sort of the tears out, and they're kind of like ready to step back in. That is a tough one. A tissue box is also another nice way that you can do that. Not that I think anyone uses tissues for their tears anymore. But I think like that's like one method in which I've used, which I find helpful, is that like that tends to happen when they start to like ruminate and like go deeper and deeper and deeper, and like their emotions kind of like, I won't say like get the better of them, because that's sometimes necessary for them to move forward, but it becomes this like spiraling like emotional like shitstorm that causes tears. And that's totally fine. Like I think sometimes you do your best work after those sessions, or like we talk about developing trust with people. Like, there's no better way to develop trust with someone than to like see them in their like most vulnerable moments, right? Like
and still be there for them, right?
That.
Yeah,
Right, and respect that.
Yeah,
but I think too, like, they also just want to get through that, and feels better after you have a bit of a cry, and then move on. So just giving them space to like regain the composure. So that would be like more on the tear side of things. On the frustration side of things, like in the session when they're doing something, it's also quite like difficult, I think, to manage. I wouldn't say I certainly get this right all the time. Something that I would lean on there is, one facet would be like choosing or like diverting or moving away from your original plan to giving them, something followed up with that they're going to be successful at, that still sort of meets the goals of what your session has for it, so they can regain confidence in it. So like if they have an issue like moving through the last 10 degrees of knee extension in a closed chain position, like that's painful for them to get to that like lockout position, then picking the same exercise but hammering that lower portion of the exercise where they get like tons of quad, and they're like, they feel like they're working hard and working out, and like they're successful in that exercise, and just avoiding that for the time being can also be really helpful from like a confidence perspective. Because I think we know this about athletes, like they want to win, right? And they want to win in the weight room. They want to win in every single rep, and they want to win, and they want to move forward, and they want to see what their progress is like. And so if you can just manipulate the exercise around things that maybe like move away from things that aren't going so well for them right now, that's causing them to get overly frustrated, that might kind of leak into the rest of the session. Just move away from that in this moment and come back to it at a later date. But I think that depends on the athlete too. Like sometimes that frustration fuels them, and it's
Yeah.
something that you want to lean into. So in
Yeah.
another breath, like I might go ahead and be like, frustration challenges this person. They love challenge. They want to move through things that are really difficult for them. As long as it's still like healthy for their knee or like healthy for whatever you're rehabbing, I might like go ahead and like lean into that issue as well, lean into that thing that they're working so hard at.
Yeah. I think 2 points on that. One is you mentioned patient cries, athlete cries. You find a way, a reason casually to exit, let them regroup, come back. I think that's an awesome strategy. Something else that I've seen work is one, humor. So I launch into this whole like not funny stand-up routine about how like please don't cry. Like I don't know how to I don't know how to handle those tears. This is going to get terrible. Like if we devolve into a therapy session, I just don't know how to handle it. So that's one thing I'll do. Another thing is I change the scenery for them. Like I will pull them across the gym. I will also and say like, hey, let's do something here. Or I'll be very cognizant. Like part of the shame in crying is it's embarrassing, right? So like if you're around other people, I want to pull you to a place where you can recover on your own. So maybe that's me exiting to give you time so you don't have to do it around me, but maybe it's making sure that I can pull the athlete away from the situation that is causing such frustration. So maybe we go to the other side of the gym, et cetera. So that's one. The other thing I think you have to be careful of, and I wonder how you handle this, and the athlete that you referenced before with such an elite level training age, so much background and education in strength and conditioning. If he struggled with something, he was furious. Like we're talking hurdles getting thrown across the gym. If I then regress to or scale to something too simple, he's basically like, F you. You don't think I can do that. Now you're giving me this crappy extra. I'm not doing anything. How do you handle that? Like you got to be careful, right?
I mean, I think you're like that decision in that like moment might be something good for him because it refocuses him on the original task. So you say like, you know what, like earn that, show me you can do this, and then we'll jump back into that. And like, and that's a motivator for this person. And I think, in this scenario, it is. And with that athlete, like it is. Or sometimes you have to be a bit of a dick, right? Like sometimes you have to step in and say like, you're just not good enough at this right now. We're not going to do 20 bullshit reps of this. We are going to go back, and this is the best thing for you. And because, you've developed that trust beforehand, they sort of like say, okay, like you only just stepped into this authoritarian position right now. It's coach and player or coach and, patient relationship, rather than what we typically do, which is work with that athlete on saying like, where do you feel like you're at today? And we build upon like what they've done that week and how they're feeling. And he has like a really big say in how the sessions go. And in that moment, you sort of step in and you provide some like authoritarian like figure or authoritative like behavior. There, they kind of step back and say like, okay, like nope, like Yoni's the man, like he knows what he's talking about. Like I got to do this. I got to show him I can do this to move into that. So I think that could be helpful in those situations. I think also too, like those are situations that we should learn from as well. And that's giving me feedback that I want to bank into my brain for all of the rest of the patients that I have either that day or moving forward, that the jump that I just made from that to this, probably isn't a successful one. It's not a successful one. Maybe it's just for that athlete particularly, but like, what are all the feedback and cues that athlete was giving me before that I missed, that I then selected this exercise and said like, this would be good for them. So I need to like retract that thought process and go back and say like, you know what, like here's all the things that were glaring me in the face that were bad. And I can think of a specific day with this athlete like 2 years ago where that happened, where we're like, you had designated me, you're going to do on-field cutting with this athlete today. We're going to do through that. So I allowed him to go through his warm-up, which he normally does. And then he was like, let's go. I was like, are you warm? He's like, yep. I'm like, let's go. Let's get straight into it. So we jumped straight into it because that would have allowed me the most amount of time to get the most amount. The first 3 reps of the first exercise were absolute dog shit. and they didn't go the way we wanted to. And the rest of the session was dog shit because he had anterior knee pain. And so like, it was a really quick reminder to me that like, I need to make sure that I do the things for the things previous to that session to make sure that he's set up for success. Next time, I basically just apologized to him and said like, look, next time we're going to go through a really specific warm-up, get it done like this way, do your warm-up, but I'm still going to have you go through the warm-up I want you to go through, and then we'll build into these drills, and did that, and worked perfectly. So yeah, I think you have to find the balance between letting people have a say and then also jumping in and letting them know like, this is exactly what we're going to do right here, right now, because I am leading this and I'm taking charge of this rehab.
Okay, so great segue. Division I athlete comes home with their packet of exercises for their off-season strength and conditioning. They're an elite level athlete. They're coming to you for maintenance work. How much leeway do you give the athlete and maybe the strength coach from the school to dictate the session? How much do you impart your will?
So is this athlete like working on anything, specifically to an injury?
Yeah, let's say they're coming back from ACL. You're the ACL king.
Yeah, but they're far along and they have a strength and conditioning packet they're working through.
They're 8 months post-op. They come in, they say, my therapist wants me to work on change of direction and rate of force development. And here are the exercise he wants me to do. What do you do with that?
Yeah, one, I think it's really important to like respect the plan that somebody at their institution gives them. So that would be first, like on the docket. I think it's really, really easy for us to step in, and I see this a lot, like in both our world and the strength and conditioning world, where it's like, okay, like here's your packet, like let's get rid of that, like here's what I want you to do. Because I think one, you lose trust from the people that are sending you those referrals. So you're not going to have the ability to work with, create a divide between you and maybe the strength coach or you and the physical therapist, like at their Division I institution. That doesn't help you serve your purpose of helping them. Now you're working against each other. It certainly doesn't serve your purpose for like getting more referrals from that source. So the first thing is, a healthy level of respect for what it is, the time and effort that they put into like producing that packet. But I think also too, like I always want to use my first session to just see if I'm 100% aligned with what that rehab professional, what that strength coach has programmed. So if they want them to work on really high level cutting and change of direction exercises, but I feel like maybe there's still a lack of strength there, like I'll just have that conversation with the athlete after their first session of doing some of those things. Like I can tell when you're making these cuts and changes of direction, like you're really like using a hip strategy on that leg, and that tells me that your quad is probably not up to snuff. So we're going to go ahead and get some baseline testing next session and just see if like I'm right or wrong about that. Right, I send them out typically to get a really high level like strength tin deck assessment and force plate assessment from one of our PTs, Rachel, or Lucas, who are awesome in Glenburn. They have a really high level, testing process there. I'm not so good at that stuff. They kind of give me a synopsis and feedback on that. Excuse me. And then I'll run with it from there. So if I'm wrong about that, then I'll still shift back into the cutting and change of direction. I'm just going to regress it down to the positions that they weren't hitting. Or if I'm right about that, I'll deliver that information to one, the athlete, and two, the institution that sent them, said like, I'm more than happy to do that. Like we're going to get there, but I think we just need to dive more into like the strength stuff first. That's going to move the change of direction and the cutting stuff along much faster when we do get to that. And that's sort of the way I would kind of like handle that. So that's our world. Like that's where we live in. That happens every summer and winter break when I kick up my schedule. So it's a great way to look at it. It also shows your humility in the process, and it's another reason, like I opened with all those strong relationships that you have developed nationwide, because you take that approach. Like you're going to give the athlete
what it is they need. It's not about you, and it's not about their strength coach. It's about the athlete in front of you. I think that bodes really well. And again, it helps for increased referrals. It helps for patient and athlete outcomes. So I think it's a great way of going about it. I think one of the things when those athletes come home and they have a packet, let's say they have a packet from an outstanding strength coach who has all the exercise science background in the world, it's beautifully programmed out. One of the things we can provide them, why they have to come to us, because by the way, that is why we feel the need to impart our genius, is because we want to show them this is why you come to me, right? For my programming, not for that guy's programming. Like, why are you coming? So I have to provide value. The other way we provide value is outstanding coaching and attention to detail. So in that given session, what are some things you're looking for? So remember, this is the athlete that's 7-8 months post. They're working on change of direction. They have everything beautifully programmed out. What are some of the things you're looking at to coach them up on?
If I'm running through a session that's already like pre-prescribed,
Yeah.
I'm just trying to deliver a kick-ass session in terms of my engagement with the athlete. I think that's huge.
Give me more there. Give me more. Like what?
Yeah,
how do they know you're engaged?
The attention that you're giving them, the feedback that you're giving them. Maybe it's not on every single rep, right? But you're giving them feedback maybe at the start on every single rep, but you pull back and give it to them on every single set or every single like exercise. You kind of like work with them. I think you get feedback from them during the session, how they feel with that. Could they go more? Could we go heavier? Do we need to go lighter? Like those things show that you're dialed into that session with them. I think that's like really important. I think something else is that's really like, I think important and lost sometimes in the programming world is not just on like the verbal communication side of things, but also on like the physical touch side of things as well. So like correcting them for like joint angle or joint position by like putting their knee in this spot or putting their shoulder in this particular position, and providing care from that standpoint kind of goes a really long way throughout their sessions. And then the last piece I would also add to that would also be just like the motivation factor, right? So just helping someone get the most out of every rep by encouraging them through that, gassing them up when they do good reps, like throwing on more weights when they're crushing it, make them feel like they're progressing faster than maybe what the packet is sort of showing, are all great ways to like show your ability to coach someone there in the moment.
Yeah, I think that's a great way to show value. Remember where that patient in this example is coming from. They're coming from a very busy weight room, most likely, or they're coming from sessions with their PT, which is a probably shared session. Like that attention to detail is amazing. You know what you didn't say? You did not say taking copious notes. You didn't mention your laptop. You didn't think about all the barriers that we put in between ourselves and the athlete. You just assume that those are removed, because I think that is one of the keys to an outstanding session. It's you and the athlete, and removing everything other than that is so important. Anything else that would make for an outstanding session? Like when you're watching other PTs deliver their care, what are you looking for so that you know that that physical therapist is providing an outstanding session to that athlete?
Additional concepts on that. That's a good.
I'll give you one. Okay, while you
one.
think, I'll give you one. I think
I was gonna say, that's why we're a month behind on notes.
Right, that is why we're a
any.
month. And you mentioned it, like you said, gassing them up. I really look for enthusiasm. Like if you hear a therapist scream out in excitement when they do a good rep, that is gold. I know that therapist is totally locked in, because there's no way they're looking at their computer. They would have missed that rep. I know that patient is getting auditory cues or feedback that what they're doing is right. I think that bodes really well for a session. So I know that therapist is delivering it.
Yeah, I think those are all good points. The other thing that like just jotted to mind that you like absolutely hammered into me, I think, and you have some personal experience, so maybe you can elaborate on this, because I think this is a great story that you tell is on like body language, and I forget the anecdote, but maybe it was a time where you're sitting in the surgery or something like that, and or you're shadowing someone called you out on your arms being crossed or something like that while they were kind of delivering a session. That's something that like has, really, sat with me. And it's something that I can pick up on like immediately when I walk into either a weight room or one of our clinics, with people that you can just see their, like what you said, enthusiasm and like body language goes a long way in terms of that too. Like you have someone sweating their ass off and your hands are like in your pockets and your legs are crossed and you look disinterested. Those are motivation killers.
They're killers, and anyone on the outside looking in will wonder what the F the therapist is doing. It just looks like the athlete is doing it themselves. The more you can involve yourself. That story was with a world-renowned surgeon named Dr. Lou Schoen. He's an ankle specialist here in Maryland. He also operates at HSS in New York City. And I shadowed him when I was in high school, senior year of high school. And I had a habit of biting my nails, which I still have. And I would just bite my nails while this guy is like delivering his plan of how he's going to reconstruct the ankle. And he pulled me out of the room. He's like, Yoni, don't wear sneakers. B, stop biting your damn nails because you look like you are totally disinterested. I took that as him being a schmuck when I was a high school senior. When I opened True Sports in 2014, I want to say by 2015, I went back to Dr. Schoen to market to him. And I said to him, Doc, got this great sports physical therapy practice. I want you to send me your patients. He's like, oh, I remember you. Weren't you the guy who would always bite his nails in the corner? And so I don't get many referrals from Dr. Schoen. But you just see how impactful body language is. I know you have mentioned it time and again with students. So if you're a student listening to this and you're preparing to come into True Sports, when you're on the floor working with an athlete, Tim is going to notice if you're just slumping in the corner. Tim is going to notice if you're just sitting, like you sit yourself on a plyo box while your CI is either coaching or your athlete is working hard. I think that's a great point. I'm glad you mentioned that. I would have forgotten about that. Okay, one more question as it pertains around the coaching world. You're working with an athlete, an ACL athlete. His objective measures look really good. His Tindex looks really good. His rate of force development looks really good. All the plate stuff lines up. But you don't think he's mentally ready to get back to sport, to full competition. How do you handle that session? So that's one. And then the reverse. He thinks he's ready, and the data says otherwise. How do you handle that?
Yeah, I think first it's really important. I think we have like a really unique method and like of being able to like work through these things, like using, quote unquote, like your coaching eye. We came from a place where we didn't have access to any of that sort of stuff when we first started. And so we had to figure out ways in which we could quasi-objectively see somebody do something, and that would sort of like give an inference to them not having the prerequisites to perform that task. I think that's a very, very valuable skill that PT should develop. And it's like one of the downsides of the access to testing and objective data that we have now. Not saying that stuff is bad, but it is one of the downsides, just the same as like ChatGPT is for us, like thinking critically on stuff. There's many amazing functions for those things, for objective testings, objective testing or like, AI in that example. But it is really important, I think, to develop a keen coaching eye for, what certain like movement proficiencies like give you an inkling in to, what they're lacking or what they don't have necessarily. I think the other thing too is it's real when you have that, you're able to, and I think there's also a lot of good research on this too, but like understanding what the pitfalls of what those objective measures don't give you. So, QI test on a 90-degree like Tindex isometric test for quad strength, for quad symmetry, right? Gives you an inkling on what their ability to like produce force is for that exact thing, right? Open chain at 90 degrees, they're X% symmetrical. there's a lot of carryover that would suggest to their ability to like run and decel or change direction, but it doesn't give you everything that you need for that. So understanding that one of the pitfalls of that testing is that it's not in closed chain, right? Like it's not, and there are different ranges that the quad like needs to work at on the field that's not meeting the demand of. And so understanding that is not like the Bible in terms of like telling you if somebody is ready is really important. And the same thing would go with like force plate testing. Understanding that there are different strategies that somebody might use in a single leg, vertical, like max vertical, that like aren't going to show up glaringly obvious on force plate testing, but visually do show up. So like using, more of a hip strategy than a knee strategy in acceleration and like deceleration phases of that. It's important to be able to understand that the symmetry on force plate testing even comes way before your symmetry on basic strength testing. And so being able to understand both of those things, those are probably the two best testing methods I think that we have for like readiness for sport or cutting or being able to objectively like measure someone's progress, but they don't speak to all of it. And so I'm going to then put them in positions that I know are going to challenge the strength, like those strength like measures functionally, to be able to see if it stacks up as well, and then say, you know what, like they have this great test here, but it's not showing up here, and explain them to them. You're not ready for this because we need to like backtrack a little bit here to just work your way into it. But you have at least passed like the base level of saying like, we're able to like move into these kind of drills. So I think understanding that from a sense of like someone who is passing things but maybe not so confident, I think that plays into that, because maybe you're not getting all the information that you need, and that lack of confidence, I think, is really like a lack of competence, right? Like you just don't meet people that have like competency in all these movement structures that still have a lack of confidence in those. So if they're able to do it well, like their fear typically will go away. The reverse side of it, I think, is probably like more common, where people feel like they're ready for more without necessarily like the objective testing. For that stuff, like I think I'm just leaning into the data on that testing, right? Like leaning into the data on, the mismatch in, the symmetries outside of 10% increase your risk by X%. Like those are really good times to let people know that, no, you must pass this KPI to be even considered for these things, because the risk of re-injury goes up by a lot. And then you're back in here doing another year of rehab. Like those land pretty well for athletes as well. So I think you're just using either the subjective, like monitoring, coach's eye, against your objective testing, and then vice versa in those different situations.
Yeah, I think you're right. I love that you hit that last example, which is, everyone feels really good about returning to sport. That's their mission in rehab, until you remind them, hey, if we screw this up, we skip a step. Remember, like that entire year we just spent together, we got to do it again. Usually puts it in perspective. Okay.
Good bit of healthy fear.
Healthy fear. Yeah. Yeah. And it goes back to reading the room. Like how much fear do they need? You got to know where your athlete is and meet them there. Tim, you have a in-person ACL course coming up in Jersey. So we already have our ACL course, our virtual ACL course that you and I put together, which has done really well. We spent so much time putting that together and thinking through what isn't out there on the market. So I encourage everyone listening to check us out. Make sure you download it. You get CEUs all over the country for doing it. What is different about this in-person course, and what specific are you going to cover or hit on from a coaching perspective that we didn't hit on the virtual side?
Yes, I think some of the differences from the just like comparing this to an online course is, I think we just spoke so much about like the nuance of being in a session versus like having things on paper. I mean, that is like the largest difference right there. Like people are going to live and experience what it feels like to be an ACL patient in a clinic while they're at this course. They're going to be putting barbells on their back, right? Like they're going to be, using blood flow restriction. Like they're going to be, they're going to get cueing by, Dr. Race Hauser or myself as a patient during the exercise. And then also as a PT during an exercise, we're going to be able to effectively give them feedback on their cueing, on their enthusiasm, right? Like on the constraints that they set up for a patient there. So you really get this like nuance into the, like, I would call it like more the like didactic type experience to the practical application of what it looks like in a session at True Sports. So I think, that speaks to some of the coaching pieces of it in terms of like the cueing. We talked about that, the motivation factor, all those sorts of things. Like we have sections in our labs to allow for us to do live demo with people. And then split up into different groups where we're going to be able to go around and sort of help people through some of the challenges that maybe they don't foresee or open their eyes to that they're not seeing. But also just the ability to like feel what it's like to be a patient in those situations. It's something that I think is, really valuable and something that you don't get from an online course.
Yeah, that was a great, that was your pitch to me when we were talking about, do we do an in-person in conjunction with our virtual offering? It's a totally different feel. Just think about how valuable that is to actually feel the exercise and then also to see seasoned experts like yourself and Race who have done it time and again at the highest levels and learn what makes a good cue, what is good motivational fodder for your athlete. Start to build your library that way. It's a course that I wish was around as I was coming up. So I'm really excited for you. What's the date of it?
So we're doing, I think it's January 10th and 11th up at Blue Iron Physio up in New Jersey.
Okay, and plenty more of those to come. So I encourage everyone to sign up for that. Obviously, of course, it is accredited for CEUs, and you get to learn from the best. Super exciting. Okay, let's close out with our Eric Cressy lightning round. You ready? Don't repeat the question. Don't ask me to repeat the question, Tim. First thing that comes to your mind. You ready? One coaching adjustment that immediately changes how an ACL athlete moves.
I would say this is the addition of constraints to the exercise. So limiting the number of variables within an exercise and setting up the environment to limit the number of variables in that exercise to get out of it exactly what you want. And so my example for that would be, go ahead.
No, I was going to say, when you're good at that, every exercise, you're getting the most out of every exercise. Therefore, you're getting the most out of every session. Great answer. I was going to ask for an example. Go ahead.
Yeah, I mean, really simple example with this, something that I've leaned on, a ton in, the last few years is just adding some sort of like vertical, like feedback model to their trunk, right? So if you're doing a tap down, it's sliding down the wall, or if you're doing a stationary split squat, it's the same thing, sliding down that wall. It's putting them on, I would call it like the total gym, like slider that only allows you to move in that plane. That doesn't allow that patient the degrees of freedom for that like forward trunk motion, which is going to change that tap down from being really quad dominant into being more of a hip strategy, right? Because as you tip forward, you create that like hinging moment around the hip. You create like stretch over the glute and the hamstring, and you bring those things more into play. You pick up more tension in that like posterior chain. So that would be, a massive, like very simple, typically free type of like constraint that you can like add to someone's work to make sure that that you're going to get that hip to stay straight and vertical and that trunk to stay vertical, which forces that knee to go forward. And that would be like, the other coaching adjustment, right? Like you just need to make sure that knee's kind of drifting towards or going forward over that toe to get more quad. And this is a way that you can do that without having to like say to them or like, manage all these things. I'll put your knee forward further this time.
Yeah.
Like, I need you here, I need you there. Then you're not really focusing on like the output. You can't really like motivate them to get through the exercise because you're focusing on so many other things.
Cool. I mean, that reason alone is why people should sign up for this course. You're absolutely right. Okay, most misleading objective metric in ACL rehab if taken out of context.
Hands down has to be the triple hop for return to sport testing. Like
Because
because there's just so many variables and strategies in which people utilize like on their unaffected leg that result in the same like objective distance that they're getting on their unaffected side. So like, namely their ability to like use their upper body and swing leg to like drive momentum forward, and then relying on their hip, their ankle, or like a stiff knee to decelerate from those positions. And this is the world that like you and I came from when we were rehabbing ACLs early on. And like, I think, the research was suggesting that you must sort of like grade over a 90% of these things. And people are doing that at like 5 months, and getting cleared. And we're like putting them through these tests, which are like, highly stressful. They're still meeting demand. And you're like, there's just no way. Like then when I go and put them on like a tap down, it's like 50%, as efficient, as their unaffected leg. So that, like those classic triple hops, 6 meter for time, crossover, like those things gave me a really bad taste in my mouth about objective testing, to the point at which like I think I've been on like pods like 4 years ago saying like I don't do that. Like I don't do that kind of testing. Like I'm testing like a pistol squat over all those things. Now like definitely changed my perspective on that like dramatically with our ability to have things like Tindeck and have things like force plate that can give you like really high level reasoning, and that, I think are way more effective at like pulling out those asymmetries. But yeah, like that drove, we talked about this earlier. I mean, that drove me to have a really good coaching eye, because I just didn't have those resources to be able to like test those things.
Yeah. Gold. You're absolutely right. Tim, awesome. You've been a goddamn pleasure as always. We could have talked about anything, but you were the perfect person to talk about coaching in sports PT, especially as it pertains to ACL. So thank you so much. Tell everyone how they can find you.
A little bit less active these days, but on Instagram, I'm dr.stone.dpt. If you want to connect there, that's good. I'm also on LinkedIn, or my email's tim@truesportspt.com. I'm also recently a new member of The Post, which is like an athletes networking group that was put together by NFL quarterback Christian Ponder. That's something that like I've been diving into really deep now. So if anybody's, a washed up athlete like myself and is interested in, connecting through that platform, I'm on, business, on sports performance. I think they have a lot of stuff in there on mindset coaching, parenting, all those kinds of things. If you guys want to connect with me there, that's kind of like a place that I'm spending a lot of time too.
Awesome. I love it. As always, a wealth of knowledge. Tim, thank you so much. Everyone listening, thank you so much. We really appreciate this True Sports family. It's been unbelievable growth. I think this is episode like 152 or 153. Downloads keep going up. Course sales are going up. You guys are apparently liking what we're putting out. We want to know what we can do better. So reach out to us, True Sports PT on Instagram. Let us know what you love. Let us know what you absolutely hated, and we promise we'll get better at it. Tell me who else you want me to have on this podcast. Take all of our courses. Sign up for Tim's in-person ACL course. Thank you guys so much for listening and all the support. Bye-bye.